What's up, YouTube? Welcome to another episode of the Undergrad Forum. Now in this video I got a guest host. You might recognize him from a video from a couple years ago, Cyrus. He is back and we are both post-match. To all of the trolls and haters who made fun of Cyrus and said, how did he get into med school? Well, he graduated. So
I graduated. There you go.
Anyways, so today's video, what'd you match into, Cyrus?
General surgery.
Alright, so in this video, we're going to talk about sub-internships and aways and do like a compare and contrast between medicine and surgery, and then you can extrapolate that to ortho, neurosurge, plastics, whatever you want, any kind of medical sub-internship, and hopefully that'll be helpful. So, Cyrus, how many sub-Is did you do and how many aways?
So I did 3 sub-internships, 2 at my home institution and 1 as an away rotation on the East Coast. Those 3 months were probably the most difficult 3 months of my life, but also the most fun because I got to do a lot of cool things. You know, as a third-year medical student, you're basically regulated to, you know, showing up, you know, standing in line, trying to be, you know, a good studier, try to learn as much as you can, try to read as much as you can. But once you become a fourth-year medical student, you're kind of a big boy now and you get a little bit more autonomy. And so I got to really grow as not only a student but also as a person on those 3 months because I got to do a lot of cool things that I never had been able to do before. Got to see a lot more cool things that I had never seen before. My two of my months were spent at my home institution, like I said, so I already knew the system. I already knew how to play the game, so to speak, because I knew where everything was. I knew the nurses, I knew the residents.
That's going to make things easier.
So that made stuff a lot easier, but then the month that I spent away from my home institution on the East Coast was a lot more difficult, but it had a lot more opportunities because I was the new guy. I could, you know, just, you know, kind of screw up and just kind of learn, you know, on the go.
Yeah, it's a new territory.
No
reputation.
And no reputation. People will kind of like let you do your thing. But also I had to learn a lot for myself because I didn't know like the EMR there. I didn't know where anything was.
It's like a steep learning
curve.
curve.
So it was terrifying at first, but it's very rewarding at the end because you really feel, especially towards the last sub-internship that you'll do, especially if you do more than 2 or 3, you'll really feel like you're just like an intern or a step below the intern, and so it's very rewarding.
And that's kind of important, I think, going into residency, is knowing that, you know, even though we all match and get in, you still wonder, like, am I good enough to do this? So it's nice to know towards the end of sub-I season that, you know, you have what it takes.
Well, I'm not saying I'm at the level of an intern.
No, but at least you're not going to do horrible. Like, you'll be okay.
But I feel confident that going in, I'll be able to at least hang with my peers who are coming in at that time.
Yeah, you're fine. I did 3 sub-internships. I did 2 in neurology. I did a neuro-ICU and a general neurology one. And at our institution, you have to do either a surgery or a medicine sub-I to graduate. So no specialty sub-I counts, so I did a medicine sub-I as well. And that was my last rotation at medical school, just for graduation points.
Going out with a bang.
Yeah, it was fun. And it's, I mean, I would say it's a lot of fun, because I remember when I first started, I did neuro-ICU, then neuro, and then actually I did an anesthesia sub-I, and then I did a medicine sub-I. I just wanted tubing experience. And I mean, when I first started neuro-ICU, I was like, I don't remember much. I mean, how am I going to manage these patients? I'm like a 4th-year sub-I, I got to perform. Yeah. And then towards the end, especially the medicine sub-I, I was like managing my own patients, working with the senior.
Right.
You know, you come a long way because I think there's a lot in you don't even know you have.
Right.
And 4th year lets it come out, which is pretty nice. So what would you say is, like, for the surgery world, what do you say, like, if you were talking to yourself a year ago, what would you say is important for a 4th-year sub-I to be doing to look good on his sub-I, perform well, and get the most out of it and, like, not burn out and have a good time?
So, medicine is obviously, you guys know, medicine is a little bit different from surgery. The surgical world, there's a lot more demands in the sense that, you know, there's a lot of hierarchy. You have to be willing to, you know, drop everything and just satisfy your superiors, I would say. But you just have to be ready to get to work. That was one of the biggest things that I took away from my sub-internships experience, is that in the beginning I knew I was going to work hard, but I never realized how much I had to work in order to perform at the level that I wanted to perform at. My first sub-internships, I thought I would be able to ease myself into it, you know, carrying maybe, you know, a certain number of, you know, a handful of patients, but then towards the end I kept challenging myself to push myself further. My seniors challenged me to, you know, they wanted me to see everybody on the service that I could see, and I just kept pushing and pushing myself further and further to see how much I could do. And you know, the biggest takeaway I could take was just be prepared to work on your sub-internship. Don't expect to go home at a reasonable time, or just don't even expect to go home. And then if you get to go home, that's just an added benefit of the day. Always be the earliest one there. Always be, you know, working. Always be following up on your patients. Never rest. Never take, you know, any time off. And always try to be the last one to leave. And if they keep insisting on you to leave, then well, okay, then you should leave. But don't go after the first time they tell you to leave. Just don't for that month, don't anticipate having any time for yourself. Just imagine you are there at the hospital the whole time and working your butt off. So.
Yeah, I mean, I think a big point to take from that is setting expectations. Yeah. I would say all sub-Is have that same theme of get there early, leave late, and try to be the hardest working you can be. But I always told myself, like, I just expect to get there early, and I'm going to expect right when I walk through the door, there's a ton of stuff to do.
Right.
I'm not going to have, like, a chill morning of emails and texts, and then, no. You walk in and it's blazing fire. And I also told myself, and I even told my friends and family, you probably won't see me till midnight. Just to kind of, like, set an expectation of I'm not going to sleep much, I'm not going to get home soon, I'm not going to get to eat. So when you actually get to, you're in a good mood all day.
Right.
So setting expectations, like, kind of low or at a place to protect yourself, I would say, from burnout. Because if you think you're going to get there and the morning's going to be easy and you're going to get out at 5, and you don't every day, you're, like, upset.
Yeah.
So trick yourself for, like, each sub-I and take advantage of that.
I would totally agree. Set the expectation that that month is not your time, it's your patient's time, it's your senior's time, it's your attending's time.
But I would say it kind of makes sense. Like, I think I think it's worth to, like, work really kind of hard, more than a normal resident would, like, suffering-wise, just for a month, to have the big payoff of good letters, having people be supportive of your residency application. I think it's totally worth it.
Right. I totally agree.
Okay. So you've been saying you need to work hard, like work your butt off. Like, for a surgical sub-I, what are they doing? Like, what is this work?
So.
And I'm gonna close the windows when he tells you.
So the work that consists in a surgical sub-internship is basically pre-rounding on the patients in the morning. You typically get there.
California.
Depending on when your team rounds, if you have, let's say a 6:15 a.m. in the morning rounds, you better.
How you do rounding so early, man? We don't round till 8.
The OR starts at usually 7.
That's early, man. So if you like sleeping, consider surgery. Maybe not.
So depending on how when your seniors get there, so typically when I was there, they would get there at, the senior would get there at like 6:15.
They're a senior.
But the interns would get there at 4:35 in the morning.
What time were you waking up?
So I would try to beat them.
Yeah, you gotta beat the intern.
So you always have to beat the intern there.
But it's not like you're bringing him down. You're beating him to make his life better.
Well, yeah, exactly.
Because you don't want, we don't want to come off.
Well,
so you want to explain. Not
I was beating them because for my own sake, I was not as fast as the intern, so I had to take more time to see patients and stuff. But you get better as the months go along. But then also, I mean, my philosophy in medical school is that, you know, it's a hierarchy, right? It's very surgical hierarchy. So I'm kind of at the bottom of the food chain in that I'm a medical student. I'm a little bit higher than the third year medical student, but, you know, I'm still a medical student. My job is to make the intern happy. And once the intern is happy, I believe his job is to make his senior happy. And if the intern's making the senior happy, then the senior is happy. And then the senior's job is to make the attending happy so that the attending can come in, you know, just, you know, be the attending that he can be, you know, just be relaxed. And if everybody satisfies their job, then the attending is happy, and then everything goes well.
And everyone learns and patients do well maybe.
So back to our topic. Pre-rounding in the morning, trying to see as many patients as I could. In the beginning, I wasn't seeing as much as I could, and then towards the end, I told you guys, challenging myself to see as many as I could, and I pretty much succeeded in doing that. Then, you know, rounding with the team, you guys know how rounds go. Trying to predict what, you know, if we were doing any minor procedures on the bedside that morning, trying to predict what supplies we needed so that they were readily available, so that there was any lag time that you could, you know, just pull it out of your pocket and look like kind of a smart person right there.
Hey Cyrus, I need a flush.
Yeah, there you go.
Oh, well, thanks. Is that how it went? Is that how it went?
That's alright. Or somebody should have this.
Or in neurology, I'll tell you, the attendings will not carry any tools, and they'll just put their hand out and be like stethoscope, hammer, and you just got to put it there.
Yeah.
Kind of
like a assistant.
Yeah, for the assistant.
But also another thing that I would do is that I would always lead rounds. So my personal belief is that the most junior person on the team should lead rounds. So as a medical student, you should be in the front guiding everybody, you know, in terms of where to go in the hospital, of trying to find the patient. So if the patient's on the 6th floor, you lead the way to the 6th floor. If the patient's on the 5th floor, you should navigate, okay, should I take the stairs or should I take the elevator? And everybody else should follow so that they don't have to think, and then they can just talk about the patient or talk about the Los Angeles Rams coming to Los Angeles. Do you know anything about football?
Nothing. Go Lakers. No, I mean, that's actually a really good point, because it's quite the opposite I noticed when I was doing my sub-Is. In my sub-Is, the fellow led the rounds because he wanted them done a certain way. Mm-hmm. And so in that case, you know, you're not going to be a jerk of a medical student and try to push them over. In our case, we were told the fellow's going to lead rounds. Don't interrupt. But in this case, he was allowed to, so... Right,
so I'm qualifying, that's what was expected of me, and I personally believe that. I mean, surgery, you just have to see all the patients in the morning. I mean, neuro, I'm sure, he just wanted to see certain patients.
Right.
So he would lead rounds. But if you're seeing all the patients, you should, you know, you should come up with a plan to how we're going to navigate the hospital so that we hit every patient, which we're supposed to do in the morning, in the... least and most efficient amount of time. Okay, so then continue with my day on a surgical sub-internship. So rounds are over at usually, you know, 7:15. Depending on the day, then you go either to the OR and scrub in on a case, or you get to go to clinic. So I pretty much did whatever my seniors asked me to do. If I knew that there was less help in clinic, I would try to go to clinic, because obviously that's where you can help the interns and the other, you know, lower year residents the most. But if the senior wanted you to go to the OR, obviously you go to the OR. So that was really dependent on where I was expected to be. I would say that it's very similar to your third year surgery rotation. Obviously, you just have a little bit more independence, and I would say you probably have a little bit more first dibs on what you want to do because you're the older of the two medical students if you're there with another third year, so you get to do what you want to do. But just always be mindful of your attending, obviously, and then also your seniors' requests and what they want you to do. And then after clinic or after the OR, I would also go see my patients at night just to make sure I didn't miss anything for that day. And then if there was an afternoon rounds, I would obviously attend those and try to lead those. And then come back for sign out or another OR case or anything, and then just kind of making sure everything was taken care of with the interns and the residents.
So a big thing I'm noticing, I think it's also a transition between being a third year and being a fourth year, is you are taking much more initiative.
Right.
You're not being sheepish. You're not being that quiet med student in the corner.
Right.
I think like as a fourth year, you kind of know how things go.
Right.
So you feel comfortable taking the lead on rounds. You feel comfortable doing something in the OR.
Right.
Yeah, actually being meaningful in the clinic.
So you should have built that confidence during your third year of medical school.
Or fake it during fourth year.
Or fake it during fourth year. But as a third year, you see what other people are doing. You've seen fourth year medical students on your rotate, like the fourth year sub-interns while you're a third year. So you see what they're doing and you try to kind of keep that in your back of your mind. This is what I have to do for the future. And especially that confidence, because especially if you're at your home institution, you know where to be, you know where to stand, you know where to go. So take the initiative. Nobody is going to look out for you. They're not going to hold your hand anymore. That's when you were a third year. But as a fourth year, you're expected to bring the energy to the ball game.
And that's, I think, a big thing. It's like they don't want to hold your hand because they're not going to hold your hand as a resident,
right?
And they want to see how you perform. It's a trial residency month, and if you do well, then obviously that looks good and you get good support. All right. So, any more recommendations or advice for the viewers?
No, that's pretty much it. Just work hard, guys.
All right, guys. Hope you enjoyed this video. If you have any questions, drop them down in the comments below. Go on the Facebook or the Twitter page, ask your questions. The community as a whole can help each other out and we can get some things done. Hope you guys enjoyed this video and learned about surgery sub-Is and ways. And as always, enjoy your studies.